We've been very interested, and everybody is interested in why people relapse after allogeneic transplant. What's the genetics and epigenetics of this event? So previously, in haploidentical transplants, it was shown that some patients actually lose the mismatched haplotype by deletion of the entire class 1 complex. This was published in 2009 by a group from Milan. And when people looked at matched sibling or matched unrelated donor transplants, it was not observed in any of those patients that relapsed. And so we tried to look at those patients, which are the most frequently transplanted patients, and ask why those patients relapse. So we didn't find any mutations in any of the immune genes, interestingly enough, either class 1 or class 2. We did find the acquisition of new mutations, but they were very similar to what we see in patients that relapse after chemotherapy. And there were no specific mutations that were currently seen patient to patient. So everybody had new mutations, but they were kind of a random array of mutations, and they weren't shared between patients. And what we did find, we went one step further and looked at the epigenetics and the transcriptome of the AML cells that relapsed after allotransplant, and surprisingly found that there was a large population of patients, almost 40% of the patients, that lost class 2 expression, which is very interesting. So we looked at the genes, they were intact, and there were no mutations in any of the genes. However, all the genes were downregulated at the RNA level and at the protein level. So not just one class 2 gene, but the whole complex. So there is a single transcriptional regulator, master regulator of the entire complex, and that's also silenced. It's called CT2A. And this gene, I think, is going to be our major focus to determine why it's epigenetically silenced, what's the mechanism. And we did show that we could reverse that silencing by exposing the AML cells to interferon gamma. So there is a way to reverse the loss of class 2, which is very interesting. The question is, can we do this with either gamma interferon in patients, or can we use a small molecule that would be mimicking gamma interferon's effect on AML cells, so we could re-induce expression of class 2 and then make them again more sensitive or susceptible to immune regulation by the allogeneic donor T cells.